Good afternoon, boys and girls. Let's talk about contractions for a few minutes. The three kinds of contractions that I gave you to look at online on your computer assignment for word work on Wednesday ended with not, is, and have. In a contraction, you do not change the spelling of the first word. You change the spelling of the second word. And so all of the contractions that I gave you ended with either a not, an is, or a have. So in a contraction, you take out some of the extra letters and you just keep a few. And once you take them out, you use an apostrophe to show that that's where you took the letters out. That's to let us know that you are combining two words, but they are not becoming a compound word. They are becoming a contraction, which is different. That's where you squeeze the two words together, and instead of it leaving them together like butter and fly become butterfly, you take some of those letters and remove them. That is the difference between a compound word and a contraction. So in the case of not, you take out the O, which means if you see a word with N and an apostrophe where the O was, and T, that word is a contraction that ends with not. With is, you take out the I, which means if you see a word with an apostrophe S on the end of it, that means that it is a contraction ending with is. With have, they take the H and the A away, which means if you see a word with apostrophe VE at the end, I'll make that V and E thicker. It's hard to write on your hand. And that means the apostrophe ends in have. So now that we know that, let's do a little bit of practice with some of the contractions that we are going to perform surgery with. Surgeons need a few things. They need a costume. I don't have a mask, but I'm going to use a scarf to cover my face and pretend that I'm a surgeon. I do happen to have some gloves around for cleaning, so I'm going to put them on and pretend like they are my surgeon gloves. I also need scissors and either a printed page of some of the words that my family helped me print from the contraction surgery page, or I need a notebook where I wrote down some of the words. And it doesn't matter which one you use, because as you can see, you're going to be able to perform the same surgery with there is printed or there is written down on a notebook page. Here we go. Oh, one more thing, you're going to need Band-Aids. So, in order to perform the surgery, let's pretend to scrub our hands. Scrub them like a surgeon. Now I want you to do something called the Turkish twist that I just learned. You're going to clean underneath your fingernails by twisting your fingernails with soap inside your palm. And then turn and Turkish twist and get those fingernails. Now pretend to rub and rub and scrub just like a surgeon would. Now hold them under the water and rinse them off. Good. Now flick all that water off, boys and girls, and we are ready to perform surgery. Let's put on our mask, because surgeons don't want to breathe on the person that they're operating on. Let's start with does and not. Boys and girls, which letter comes out of does and not? It's never the first word, it's always the second. So if I go back and I take a look at what I was noticing before, the O comes out of the not. So I need to make a cut right here. Carefully, surgeons, don't hurt your word. Now that I have them cut, I'm on my way to making my contraction. Doesn't. However, I have to sew it up or figure out a way to put the apostrophe in. That's where my Band-Aid comes in. I'm making a YouTube video just so you know. Surgery doesn't usually have a burping teenager, but Mrs. Schmidt's special surgery ward does. Boys and girls, here we go. Let's put the apostrophe in between the N and the T. My apostrophe wants to stick to my fingers and not just to the word, but we're just going to manage our best. There we go. Now, we have our apostrophe. I'm going to trim that extra off on the bottom because apostrophes don't go along the bottom line. They go along the top line. So here we go, boys and girls. Does not became doesn't. And if you want to leave little room between the two words, you can always fold them so that they look a little bit more like one word if you want to. And there's your word, doesn't. After this, you have to carefully dispose of the O and of the Band-Aid mess so that your family doesn't have to clean up from your surgery, because all good surgeons clean up their messes in the operating room before they move on. And then we check on the patient. We say, "Are you okay? Are you feeling okay? Yes? You're feeling good? Congratulations, surgery's over. You're a contraction now." You can do the same thing with words like they and have, and there and is. Shall we do one? Just in case you're not sure, you can watch on. If you're pretty sure that you're done, you can stop the video and go perform your own surgery. I trust you. Let's take there and is. We know that when we are taking is, we take out the I. So we're going to remove that I right now. Careful with your patient. Now we have to connect them to show that they're a contraction. So using the Band-Aid as our apostrophe, let's connect them, shall we? And congratulations, there is became theirs. Finally, we have one more to do. We've done a not word, an is word, and now we'll do a have word. With have, we take out the H and the A. So let's take them out. And now we have they've, which means they have. Take out our Band-Aid, make it an apostrophe to combine our word and get it safely made into a contraction. Not looking for perfect, looking to understand how these words are combined and have a little bit of fun while learning them. And there we go. They have became they've. Boys and girls, once again, when you're done, clean up your surgery site. You can make as many as you would like, as many as your parents say is okay. So great job, surgeons. When you're done, you may remove one glove and then the other. Clean up your surgery mess. Thank your patient. Thank your assistants. I didn't have any today. And you're all set. Go ahead. Have fun.